When somebody has a ischemic stroke, what are the important parts of recognizing the symptoms early? That's really the message I want to get through here today. Is it important, or is it important not to do anything and be sure the patient's quiet and not get anything done, which is...
I think the most important thing that we know is time. When you recognition of the symptoms and deficits, and then time. The acronym we like to use and teach, it's a national push to use FAST. FAST stands for face, arm, speech, time. So you look at someone's face, you have them smile, and if one side of their face droops, usually the corner of the mouth doesn't come up, that's a point. You have them hold their arms up. If one arm drifts down a little bit, that's another point. And then you have them say something like, "You can't teach an old dog new tricks." And if it's slurred or you can't understand it, that's another point. If you have 1 point on that scale, it's about a 72% chance of that being a stroke. If you have all 3 points, it's about 85%.
So if we were hanging out with a bunch of friends and somebody started having problems with their face drooping to one side, weakness on one side, and somebody mentioned the word stroke, what do you do? What should we do?
Well, the last letter of FAST is time. So T is time. Dial 911 immediately. That's the most important thing that you can do. Recognize and then dial 911 and tell the operator, "I think this person's having a stroke." If you initiate that language of stroke, they'll know exactly what to tell the paramedics. When they arrive, they'll know exactly what to do with the patient in terms of evaluation and transport to a hospital.
So with a stroke, with an ischemic stroke, and you're not getting any blood to a certain part of the brain, how long before that brain loses its ability to think? When time is important, how quick is the time?
It's very quick, and you know, some studies have shown us that if there's a blocked artery in the brain, one of the main arteries to the part of the brain that's blocked, you lose about 2 million nerve cells per minute that blockage is not removed. And so there's variable factors in terms of the blockage and how much blood circulation you have in your brain. Everybody's a little bit different, but in general, if that artery is not opened up, you're losing brain cells by the minute.
So we have to get to the emergency room quickly so we can remove that clot. Now, you mentioned it could be to a bleeding into the brain. How do you differentiate? If it's bleeding, you don't want to give something to make people bleed more, but if it's an ischemic clot, you want to be sure and how do you tell the difference?
The main way we tell the difference between whether it's ischemic or hemorrhagic is to do a CT scan of the head. It's an X-ray of the brain, and we can tell immediately on that scan whether there's bleeding in the brain or around the brain, or whether there's no bleeding in the brain. So that tells us immediately.
Is that with just a simple X-ray of the head, or is that with a CT scan, or that X-ray has to be done quickly?
It's a CT of the head, and that's the #1 test that we do right when someone enters the emergency department.
What do you look for?
We look for blood. We look to make sure that there's no bleeding in the brain, and if there's not, then that tells us if the deficits are correct, this is probably a stroke, and an ischemic stroke, and we need to treat it as such quickly.